The crisis of access to veterinary care is enormous in our country right now and ever expanding. 1 in 4 families can't afford veterinary care. A lot of those families are experiencing barriers to care, especially if large expenditures come up suddenly.
So much of what we as veterinarians are trying to achieve is only accomplished if we create a bond with our pet owner. We're asking them to potentially do some difficult things. There is no algorithm that exists that says if A, then B, and that's the art of veterinary medicine. I'm Lisa Milot. I'm the Annie and Zach Stanton Distinguished Professor of Canine Welfare Law at the University of Georgia. I am also the director of the Practicum in Animal Welfare Skills, and my students and I, in that capacity, work with jurisdictions around the state to improve shelter processes, animal control practices, and local ordinances. Access to care is something I've looked at a fair amount in conjunction with some of the programs that my students and I run. And from what I can tell, there are a couple of reasons access to care is being flagged, at least, as being an issue right now. I don't know that it's worse than it has been in the past, but it's definitely something that's getting a lot more attention. And I think in the last maybe 5 to 8 years, we've become much more concerned about whether there are systemic factors that are preventing them getting vet care, something other than their owners simply not choosing to get it for them. Poverty is a very clear example of one factor that could prevent them, but there's other things, and I think that as the awareness of those have grown, we've talked a lot more about access to care. So it might be people who live in a veterinary desert and don't have a car. You can't very well take your animal on a bus to get to a vet's appointment, or it might be language barriers where the people at the vet's office speak a different language than the client. And it might also be a lack of information, people who aren't aware of the annual needs or why it's important to actually get them to a vet regularly. And so as we've become more aware of those factors and looking into them, I think that there's been a lot more research and summits around lack of access to care. My name is Janet Martin, and I am a doctor of veterinary medicine. COVID-19 was, I believe, devastating to veterinary communities across the board. Our access to our clients and our patients was so severely limited during the pandemic. We were unable to have face-to-face conversations with our pet owners, which really impacts the nuances of our ability to figure out what's happening with their animals. It really, really almost spoiled veterinary medicine for a lot of practitioners because you just didn't have that connection with your clients. That is so important.
My name is Sarah Gonzalez, and I'm a clinical associate professor of community practice at the University of Georgia. I've been a veterinarian since 2011, and I think over the course of my career, I've seen a shift in the level of trust between pet owners and veterinarians in general. And I do everything I can to instill the most trust in my clients and make sure that we're putting their animals' best needs at the forefront. But I think a big challenge with that has been in the past several years, the cost of veterinary care has increased dramatically. And I think when you add that into the equation, that makes it a lot more difficult for clients to make the right decision or the decision that they want to make, given that limitation. And that ultimately comes down to myself as an employee or as a business owner that I have to meet certain costs as well, and that can create some strain in the relationship for sure.
My name is Spencer Johnston. I'm the James and Marjorie Wagner Professor, and I am the department head for small animal medicine and surgery here in the College of Veterinary Medicine at the University of Georgia. I have heard it said by members of the general public that it's very expensive to seek veterinary care now, and that sometimes they're not convinced that veterinarians are always acting in the best interest of the animal, but instead they're more profit-oriented. That is particularly concerning if the general public starts to lose their confidence in a veterinarian and they think that they're more profit-driven. That means that they'll be less inclined to seek that care. They may be less inclined to accept the recommendation of a veterinarian.
When a community doesn't have very good access to care, whether they're in a veterinary desert or there's a different reason, I think it can lead to a situation where lack of care is actually normalized and it's just expected. And so if nobody in your community is taking their animals to the vet regularly, or none of the dogs in your community are on heartworm preventative or are neutered, you are much less apt to break out of that mold and do it yourself. And so it's a self-perpetuating cycle, and it's hard to break out of and sort of change the mindset even once you start figuring out how to provide that access.
We often talk about the human-animal bond, and we know that that bond is very strong. Those individuals want to provide the best care for their animal, and they will often do so and often sacrifice their own care in order to provide that care. If it becomes a matter of financial resources, then it is very stressful to the owner.
And then I think there's also the public health aspect, which is a burden on communities because we have animals that have diseases that can be transmitted to humans, like rabies is a huge one. From the spay-neuter perspective, we have unneutered animals that are potentially more likely to roam, and those animals may or may not be fully vaccinated, so the whole thing just becomes a problem.
My name is Dr. Kristen Jankowski, and I work for the Open Door Veterinary Collective as the Director of Veterinary Services. And for the Open Door, I work to create training programs for both veterinary students and practitioners on how to practice across the spectrum. We've been doing spectrum of care for a long time, but we've given it a little more terminology recently, and it's the ability to provide evidence-based care options that range and acknowledge clients' wishes, their desires. It also acknowledges limitations of the provider and of the patient. It doesn't just mean less expensive care. It doesn't mean less thoughtful care. It's about really taking into consideration the client, the patient, and the provider, and coming up with ranges of options that work best for all three. The gold standard is fraught with complications because historically in our profession, it has been taught as the most technically advanced and therefore often the most invasive option. And although you can have a particular best treatment option for a disease, that does not take into context the client or that individual patient. So instead of thinking about it as gold standard, we like to think about it as best options and best options for in that context.
The spectrum of care is really a philosophy. I don't know that you can actually just teach a course in spectrum of care. The spectrum of care is made up of various skills. A large part of it is communication skills. And so you need to be able to communicate with owners and find out what's the problem, what is their concern, what are their goals for the treatment. Then you need to know the medical part of it. What is an option for the treatment of a particular condition? Then basically what you need to do is to practice those and merge those. And there are many other components that go into spectrum of care, but you model that through a clinic and you practice it. So someone who practices spectrum of care takes all the knowledge that they have and applies it to create the best situation for that animal, that client at that time.
There's never a black and white answer. And as a veterinarian, I think we're talking about spectrum of care now because suddenly the possibilities of treatments and diagnostics have become so high-tech and so wonderful in many ways, so many great options, that we've realized that a lot of that is outside the reach of many of our pet owners. And so therefore we need to have the ability to come up with some other options for them.
I'm Katie Deal. I'm an associate professor at the College of Vet Med. Thinking about how vets can best educate their clients for making decisions in the spectrum of care context. What I'm doing as a clinician and also trying to train veterinary students to do is get the client educated about the case and get them on a level that allows them to understand what's going on and make decisions. You've got to provide them enough information about the basic physiology, anatomy, and then the medical condition, and then the options to help them make the best choice.
It's really important that we encourage the clients to share their concerns with us at every point. And really, we always reiterate that they know their pet the best and that we are there to help. We ask them, what's your top priority today? What are you most concerned about today? How is this working out for you? Are you finding that you're finding the time to give them medications, or is it stressful for you at home? Just opening the door to say it's okay for things to be hard, and we're here to listen to you, and not just saying here's your treatment plan and out you go. We're working on some things to provide self-advocacy information for clients so they know that they can ask, I am having financial concerns. Is there another option? I can't get back for the recheck. Would I be able to do a check-in over the phone? Could I send you a photo? Encouraging them, those things are totally valid and fine. We want them to feel good about the care plans that are decided upon and know that we can always change course if things aren't going well. You can also use payment options that are not governed by your practice. So people who are working hard, but maybe working paycheck to paycheck, they can pay for things. And we have studies that show that clients, want to pay for care, but they just need to be given options that work in their situation.
People will be more likely to take their pet to the veterinarian if they understand that there are options and that veterinarians are there to try to work with them to find the best option. So it's a positive thing. It's not a limiting thing.
I think the majority of problems within veterinary medicine between veterinarians and clients is a lack of clear communication. As you're talking to your owner, it's very vital that you don't make assumptions about people. You don't make assumptions about people's ability or interest in the high-tech stuff. You offer, discuss, offer other things, discuss, until you reach a point that works for everybody.
Prevention is huge. If people are not able to provide preventative care because of multiple barriers they have, then they're presenting with problems that are quite severe.
There are so many preventable things that we can help our patients with, such as infectious diseases from vaccinations, heartworm prevention, flea and tick prevention, all that really go to this day-to-day quality of life for our patients, and that is much easier to prevent than to treat.
A lot of vets express concerns about liability and professional censure to me when we're talking about spectrum of care. They aren't really sure what legal standards apply, and they're well aware that an upset client only sees their particular case. I've spent a little bit of time researching what exactly the liability might be based in, because there's no veterinary malpractice that's equivalent to med malpractice in terms of treating the animal as a victim. Instead, any cause of action with respect to the vets is going to be grounded in negligence. And in negligence, the question is whether this vet acted as a reasonable vet would, given their credentials and the situation. So would other vets, on average, have made the same decision making? And once we start looking at that, it's a question of what is the applicable standard of care? What is the sort of actions a reasonable vet would take? And so Dr. Deal, Katie Deal, and I did some research based on a grant from the Stanton Foundation into the frequency with which actions, either legal actions or disciplinary actions, were brought against vets for failure to meet the standard of care.
If one of the barriers to practicing spectrum of care is fear by veterinarians that they're going to be sued or otherwise, maybe have a bad reputation, we wanted to investigate if that was based in evidence, and if it was, what were the typical cases that were being brought, so that we could best help navigate that?
And we looked at a 10-year period of time because that was what was published on the Georgia State Board Veterinary Medicine website in terms of the consent orders that have been made public. And what we found was 42 cases of disciplinary actions against veterinarians in that 10-year time frame that implicated the standard of care. And so out of the 42 disciplinary actions, we found 9 that actually were on point for what we were looking at. And on the disciplinary action side, the biggest problem was one veterinarian who had allowed human medical doctors to use controlled substances under his license. And that one had an outsized penalty associated with it. But the other ones were all about record keeping or about not disclosing properly to a client or some sort of actual mistake. And with respect to the lawsuits, the 24 cases we identified with a defendant veterinarian, there was actually only one that was on point. And in that lawsuit, the vet was actually dismissed as a defendant, was found not to be at issue in the case. And so on the legal side, in that 10-year period, there were 0 cases where a vet was actually found liable for not meeting the standard of care. What that tells me is that if a veterinarian acts responsibly, keeps the notes about the client he or she should, talks to the client about the options and discloses the risks and the range of options as well as the possible benefits, and is just careful, just as he or she would be in any other circumstance, there is likely to be a very low risk of any sort of negative consequences. So some of the spectrum of care approach is taken in brick and mortar vet clinics, but there's also other resources that have come about to provide clients with better access to care and to reach the clients that maybe can't travel to a vet office.
The Open Door Veterinary Collective is a nonprofit group that works to provide care and connect families with care in many ways. We do everything from provide and develop training modules for veterinary students and practitioners on how to practice across the spectrum. We manage a website called Pet Help Finder, which is active in North America, and thousands of people can go to that site to get connected to care. So practices can be listed on there for being able to provide everything from low-cost spay-neuter to food resources to even housing, co-housing for families in need of urgent care housing together where their pet can come with them. We also do mentoring to practices to help them. How can you do this? How can you provide access to care and still remain financially sustainable? And we have community partners, we have education there. So it's not just about the veterinarians and things, it's, social workers and community leaders. So the list is huge, and I sometimes feel even as an employee, I can't keep up with all the new things that Open Door does with our tiny team, but we're all very passionate about our work.
Pets for Life is one that the Humane Society of the U.S. came up with that provides basic pet care in the community itself. And it's not in-depth interventions, but it does involve people coming to pick up pet food donations or to schedule a spay or neuter and then getting the basic shots for their pets. My students and I developed a variation on that where we are working to change norms in certain communities by spending 6 months actually as the initial phase, going in every other week and providing the basic vet care on a progressive basis rather than at one time, while my law students talk to the owners about proper pet care and about the legal requirements for pet ownership, and vet students work with our vet team so that they learn about community care and are a little better prepared to practice spectrum of care once they go out into practice themselves.
Partner programs can definitely enhance your ability as a veterinarian to engage with your community in different ways than potentially you can as a private practitioner who's seeing the clientele that come to you. It's a way of reaching out a little bit further with your veterinary care for the community. So by partnering with groups that are working, especially with underserved populations, immigrant communities, lower income groups, people who have language barriers, transportation barriers, your ability to reach out to those other communities that aren't necessarily bringing their pets to you in your brick and mortar facility is hugely appreciated by both the organizations, the partner organizations, and also the pet owners.
Taking a spectrum of care approach, I think, can help mitigate some of these barriers to access to care by giving the client a little bit more control in decision-making, in having the information that might be necessary to make the best decisions, in different price points for an intervention. And I think all of these are incredibly important so that people who have not traditionally accessed pet care can feel comfortable when they go to the veterinarian's office.
As I've gotten involved in the Spectrum of Care initiative at UGA, I think a lot of general practitioners have been saying, well, I'm doing Spectrum of Care. I don't understand why we have a name for it now. I think that all general practitioners are practicing Spectrum of Care every day, and they're the home base for providing care to the most animals. And so for us, I think a lot of drawing the attention to it is really drawing the attention to educating our students in this so that they don't have to spend years in practice like honing some of these skills and these communication skills, and that they can start working with them earlier in their clinics at University of Georgia. And then as it's become more of an initiative and more of a focus of the veterinary community, I feel really lucky because I've seen all the animals that have been helped by us being able to offer a spectrum of care.
This is something that we all need. It's really a very small slice that can do that highest technology option. So if we can have people feel a sense of choice in healthcare, then I'll feel that we have done absolutely the right thing. Treating with context comes with a lot of positive emotions. You've been like, I have creatively come up with a solution that not only my client is happy with, but is going to have potentially a good outcome. And then I feel, as the provider, really satisfied that I was able to provide something that everyone feels good about. So I think that team spirit, you're on a team with your staff, a team with your client, a team with your patient, that feels really good.